session by introductory remarks by the Honorable Minister of Health and Family Welfare of the Republic of India, followed by remarks from each of the Honorable Ministers and dignitaries.
Namaste. Excellencies, I thank you all for joining the Voice of Global South Summit. Let me also take this opportunity to wish you a Happy New Year. Excellency, the COVID-19 pandemic has taught us that we live in an interdependent world and we are all vulnerable when it comes to managing any public health emergency. It has highlighted the existing challenges in health systems and highlighted the need for a 360-degree transformation of healthcare delivery pathway and infrastructure. It is the need of our to focus on long-term measures to build stronger, more resilient health system that can prevent, prepare for, and respond to future health-related challenges while maintaining essential health services. Excellencies, India has assumed the presidency of G20 this year. As a part of the Global South, India's presidency has a special significance. Our Prime Minister has said our G20 priorities will be shaped in consultation with not just our G20 partners, but also our few travelers in the Global South. It will be our effort to take the voice of the Global South to G20 and other international forums as partners in our development journey. Accordingly, India has prioritized its health track to build concerns at global level, focusing on converging ongoing efforts, mapping health resources, and connecting them to most deserving areas so that health equity can be assured at global level and particularly to Global South. Excellencies, the pandemic has highlighted the importance of capacity building of the existing healthcare workforce. This will enable them to provide quality and affordable healthcare at local level to cater to undeserved communities in the Global South. The consistent investments made by India in primary healthcare workforce had paid dividends during COVID-19 vaccination campaign. I am happy to highlight that so far we have administered more than 2.2 billion vaccine doses with 90% second dose coverage of 12 plus population and 220 million precautionary doses. India's experience has reinforced the fact the capacity building of healthcare workers coupled with harnessing digital technology is the way forward. Excellencies, it is in this context that India has been supporting in terms of building the capacity of healthcare professionals in various countries through tailor-made training programs. India organized online training programs of COVID-19 testing clinical practices, case management, vaccine development and delivery, with 1,000 plus participants from Asia, Southeast Asia, and African countries. India also shared its medical expertise by dispatching rapid response teams to Kuwait and Maldives. With all its challenges, the ongoing pandemic has also been a catalyst for the growth and accelerated adoption of digital tools. In the spirit of Seva, that is service, India has offered CoWIN, indigenously developed vaccine management platform, as a digital public health good to the world. In the CoWIN Global Conclave held on 5th July 2021, with 140 plus participant countries, India reached out to offer the CoWIN platform as an open source software free of cost to any interested countries. India has also offered CoWIN as a digital public health good to WHO through WHO's CTAPS initiatives. Excellencies, under India's presidency, the proposed G20 Global Initiative on Digital Health will prioritize the digital agenda and contribute towards bridging the digital divide. This initiative will bring together scientific expertise, collect best practice, develop digital public health goods, support implementation and institutionalize use of digital tools in health service delivery with specific focus on LMICs. It will promote digital health tools implementation, including health data interoperability, natural data sharing across country, so crucial to provide data-driven insights into health program and aid policy. It will promote collaborative, responsible, and impactful use of data and prioritize the implementation of cutting-edge digital tools like telemedicine, teleradiology, telepathology, and EICU. Excellencies, India under the leadership of Honorable Prime Minister Modi ji has also taken a paradigm shift in terms of promoting holistic health as the way forward. Allied with this approach, 150,000 health and wellness centers have been established across the country to provide preventive, promotive, and curative, rehabilitative, and palliative care covering primary and secondary health services. Further, India's civilizational ethos emphasized on not only therapeutics but also wellness as an approach in healthcare. Traditional medicine and yoga, including pranayam and meditation, are India's contribution to the world in its quest for such holistic well-being. India has a rich heritage of medical wisdom derived from the Vedas that prevailed as Ayurveda. Other systems practiced include Unani, homeopathy, and naturopathy. Yoga has been recognized as a physical, mental, and spiritual practice to bring harmony to mind, body, and soul. Since 2015, the world has been observing the International Day of Yoga with huge participation. Excellencies, for millions of people, traditional medicine is the first part of call to treat many diseases. 170 out of 149 WHO member states have reported the use of traditional medicine, and their governments asked WHO to support in creating a body of reliable evidence and data on traditional medicine practices and products. Government of India, in collaboration with WHO, has established the WHO Global Center for Traditional Medicine at Jamnagar, Gujarat on 19th April 2022. The center aimed to harness the potential of traditional medicine from across the world through modern science and technology to improve the health of people. India focus on four strategies areas of evidence and learning, data and analytics, sustainability and equity, and innovation and technology. We would like to work with our partners in the global south to harness the potential of traditional medicine to promote health, wellness, and people-centered care, prioritizing cost-effective research supported by regional manufacturing networks can aid timely availability of cost-effective vaccines, therapeutics, and diagnostic, commonly known as medical countermeasures, creating an enabling framework for clinical trials, R&D support by harmonization of regulatory standards can support the availability, accessibility, affordability of medical countermeasures across the world, including LMICs. India has accordingly proposed medical countermeasure platform under its G20 presidency to ensure availability of vital vaccines, therapeutics, and diagnostic to LMICs and LICs. Excellencies, India believes in value-based healthcare and is continuously striving to provide high quality and cost-effective healthcare to anyone. Under the soon to be launched Heal in India initiative, India aims to provide its health infrastructure for patients abroad and make it a global hub for medical and value-based healthcare for patients from across the world. With more than 1.3 million allopathic doctors, 3.4 million nurses, and 800,000 Ayush doctors, India would help provide required care to patients from all countries, including Global South, through quality and affordable medical care imbibed in India ethos of Vasudhaiva Kutumbakam, which means that whole world is one family. As Honorable Prime Minister of India has said, our priorities will focus on healing our one earth, creating harmony within our one family, and giving hope for our one future. Our interaction today offers us a great opportunity to deliberate and find the solutions for Global South in the spirit of being one family. I look forward for contribution of all fellow honorable ministers and other colleagues in today's deliberation. Thank you. Jai Hind.
Thank you, His Excellency, for highlighting crucial challenges